I'm Dr. Kim with Inline Chiropractic, and welcome to Deep Dive. Deep Dive is where we go a little bit deeper into one subject every month. This month we're talking about why we should keep our resolutions because it's January and we've all committed to treat our bodies better and to restore our health. So far, we talked about why your commitment to Whole30 or Paleo will be a lifelong goal for you, especially if you have some autoimmune disease. We've also talked about exercise and how it's so much more than weight loss and looking great in a swimsuit. This week, we're going to talk about sleep. Sleep, in my opinion, is one of the most underrated components of long-lasting health. We're going to talk about 4 reasons. I'm tired. We're going to talk about 4 reasons that you really need to try to get some sleep and things that you might not already know about sleep. I'm a chiropractor, so one of the questions I get asked at least once a day, 4 days a week, is how should I sleep? What pillow should I use? What kind of mattress should I have? So we know we should be concerned about sleep, but we really don't know anything about it, right? So here are my recommendations. You should sleep on your back. When you sleep on your back, you give your spine a neutral position. We're not cattywampus with all of our arms. We don't have our head turned to one side. You don't have a hip pulled up. So we're not contorting and giving input to the brain for 6, 7, 8, 9 hours at a time that we should shorten any muscle. When we sleep on our back, we allow for proper nervous system flow. We allow for proper alignment of the spine. So sleeping on your back is always best. When you sleep on your back, you want to sleep with a low pillow or a cervical pillow. You don't need to have your head all up to the side when you go to sleep, or you don't want to have it all the way extended. So low pillow or no pillow. If you go to my notes, you can actually see a couple of links that I really love for pillows. And before you start hemming and hawing, telling me, I just can't sleep on my back, I've tried and tried. I'm guessing the first time you tried beer or wine or any non-super sugary drink, you didn't really like it. But you know what? You decided that you were going to keep drinking it. So, if sleeping on your back is what's best for your body, what's best for your shoulder pain, your carpal tunnel, if it's what's best for your hip pain, if it's what's best for your knee pain or your leg pain, I suggest you get to work on sleeping on your back. That's what I think is best. Your mattress should be firm. Soft and squishy is a no-go. I actually like the hybrids. I like the idea of the purple mattress. I have no affiliation with the purple mattress whatsoever, but I like the idea of a grid system that gives great support with flexibility and then having air-pocketed cushions over top. So I really like a hybrid mattress that has great support with a foam topper. I do not like memory foam. It collects a lot of dust and dust mites, and it gets really hot most of the time, even with the vent cooling system. So I'm just not really a fan. I've heard that multiple times from multiple patients. So I'm not a fan of the memory foam mattresses. But I really do love the hybrids, and it should be as firm as you can handle. Now, if you're lay on your back and you have lower back pain, that's an indication that you need to come see a chiropractor, and you need to work on those hip flexors. You've got a pelvis that is rotated anteriorly. The hip flexors are nice and tight, and when you lay down flat, they spasm out. So if you're having lower back pain when you lay down on your back, because back is best for sleep, because you want to have a neutral spine, back is best for sleep, especially as an adult, back is best. If you're having lower back pain, that's because you need to either put a pillow under your knees to help take some of that anterior tilt out, or you need to start stretching out your psoas, or some sort of combination of both would really be most helpful. So that is the number 4 thing that you need to know about sleep. Sleep on your back, low pillow, no pillow, firm mattress. I get asked these things all the time, so there you go. Free advice, right? Number 3, what do you not know about sleep? We know that we feel better sleep, it's restoration, but what you might not know is if you are proudly wearing your I didn't sleep badge and you're also struggling with weight loss or infertility or PCOS or chronic fatigue, It could be because you're not sleeping well. You're not getting really good restorative sleep. So sleep is the cycle that actually resets the organs. It resets the cycle of how the adrenal glands rise and fall to help you rest, to help your body fight against stress. Sleep is when your human growth hormone is released. Sleep is when you allow for normal sex hormone balance, when you allow for normal stress hormone balance. So the reason that you can't lose weight if you aren't sleeping is because you're not sleeping. Ask any mom who's up all night long with her little kids and she's trying to lose weight during that first year. It is nearly impossible for some of us, especially if we struggle with our adrenal glands. It's nearly impossible for us to lose weight until we can actually sleep through the night. So hormone balance is really deeply affected by how well you sleep because it allows for that diurnal pattern. It allows for a normal cycling of the hormones, sex hormones, of the sleep hormones, melatonin, the cortisol, which is your stress hormone. It even helps to reset insulin. So it really is very imperative that you get 6 to 7 to 8 hours of sleep every night. And having a set routine is very helpful. No screens for an hour before. If you can turn off the overhead lights and maybe just do a candle, that will help actually tone down the occipital stimulation or the visual stimulation that the brain is receiving. When you get visual stimulation or occipital stimulation, what it tells the brain is, we got stuff to do, yeah, we got stuff to do, yeah. So when you can break down and stop some of that visual stimulation at night, it will actually help you get into a deeper level of sleep. So read, or heaven forbid, have a conversation with your spouse. Really try to relax, turn the TV off, get off the daggum phone. It's creating depression, it's creating anxiety, and it's keeping you awake, so just turn it off. So turn off your phone and really get quiet. Do the same thing in the same way every night so that it becomes an automatic pattern in the body. Now, if you're having a difficult time falling asleep, melatonin is the hormone that induces the sleep cycle. Melatonin is not addictive. Melatonin actually is autoimmune protective. It is actually brain protective. So it's really important, if you are having a difficult time getting to sleep or staying asleep, that you use melatonin or a sustained release melatonin. And you come talk to me, we get some tests done, we figure out why you aren't able to go to sleep and stay asleep. So really want to work on getting to sleep and staying asleep for your hormone balance. Think about weight loss, PCOS, sex drive. Think about your ability to build muscle, your ability to think straight, your ability to respond to stress. That's what I'm talking about when I'm talking about hormone balance, okay? So sleep is imperative for hormone balance. Number 2, the thing that you might not know about sleep and you need to know is that mouth breathing or snoring can be a far bigger deal than just annoying. It's so much more than a dry throat or a spouse that can't sleep. And it's not only about the oxygen saturation. Yes, that is a key part in leading to some of the symptoms that follow being a mouth breather when you are asleep, or a mouth breather in general. At the root, mouth breathing is a disconnect of an automatic nervous system process. So basically what has happened is that your brain has forgotten how to breathe through its nose. Your brain has disconnected from your diaphragm that will lift and fall the lungs. And so in order to train this back to normal, it's really pretty easy. We start with cycle or box breathing. So you're going to breathe in for 4, you're going to hold for 4, you're going to breathe out for 4, and you're going to hold for 4. So in for 4, hold for 4, out for 4, hold for 4. Box breathing. We're going to start with that because that's going to reset the nervous system. And then as we train that mouth breathing and we train that diaphragm to be back in sync, you are literally going to, you can physically, if you need to, pinch your lips. You're going to lay down with a lightweight book or a lightweight something on your chest, and you're going to practice breathing in through your nose while it's weighted. We're going to literally overtrain. This is called neuroload. We are going to neuroload the breathing pattern to reconnect the brain to breathing through the nose and using the diaphragm to do so. So if you're a mouth breather, what can happen is it's not just about sleep apnea, right? It's not just about pushing pressure back into the cavity so that the vocal cords stay awake, so that the neck doesn't collapse. That is a big deal, yes. But we're really looking at a brain-body disconnect. Your brain has forgotten how to do an automatic process, and this is not good. So we really need to work with that, because when you do not have great oxygenation, so breathing through your nose is where we get the primary, the deepest oxygenation level is breathing through your nose. When you are not breathing through your nose, you're not getting well oxygenated. And when you have a decrease in your oxygenation saturation, especially if you're anemic, so side note if you're anemic as well, but if you have a decrease in that O2 saturation, what you're going to experience is inattention, anxiety, fatigue, ADD, defiance, oppositional disorder. You're going to see all these because your brain isn't getting the oxygen that it needs. Your body isn't getting the oxygen that it needs. So oxygenation or O2 sats through mouth breathing are decreased. O2 sats through nose breathing, much more direct pathway to the lungs, and you get a much higher level of oxygenation. So if you're a mouth breather, if you're a snorer, it's not just about sleep apnea. It's not just about not breathing. That is a big deal, because we are absolutely worried about that O2 saturation, but we are also worried about the disconnect between the brain and the lungs. This is an automatic function that happens at birth. And so when our brains forget how to do that, there are a myriad of changes that happen. You have neurological and gastrological complications that come when you do not have a connected brain to breathing pattern. So how do we correct that? One more time. You're going to lay down flat on your back. You're going to close your lips. You're going to put a lightweight book, or you're going to put a lightweight pillow or a heavy pillow on your chest, and you are going to practice breathing in and out with the pillow on the chest, watching it rise and fall, because we're going to neuroload, and we're going to tell the brain, this is how you breathe, this is how we do it, because you got to remind it that this is how you do it. You got to remind the brain, this is how we breathe. We don't do it through our mouth, we do it through our nose. So that is the second thing you need to know about sleep that you probably just didn't connect, because all we talk about is a sleep study and sleep apnea. And it's far more than sleep study and sleep apnea. If you're a mouth breather during the day, same thing applies. You're probably suffering from inattention, anxiety, ADD, fatigue, chronic fatigue, digestive disruptions, brain fog. All sorts of problems are happening because you're a mouth breather and you're not getting proper O2 saturation. Sleep is a beautiful picture of how well we really need to be oxygenated. We close our mouths for just a little while and we allow air to come in and out, and it should flow nice and easily through your nose. And if it doesn't, that's a whole nother set of conversations about nasal passageways and food sensitivities and dust mite sensitivities. Might be time to change your mattress, change your pillow, change your sheets, wash your sheets. But that's a whole nother set of conversations to have. But that mouth breathing is super important to change because of the overall influence that it can have in the body. So if you're a mouth breather during the day, or especially at night, if you see a kid who has open mouth, just like all those funny cartoons, if that's your kid, we need to talk. If that's you, we need to talk. If that's your husband, we need to talk, because that is a disconnect between the brain and the body in an automatic nervous system process. And this is a big deal for the brain. Okay, I need to make that really clear. This is a big deal for the brain. Breathing while you sleep with your mouth is not how we are wired to be. So we have a lot to talk about with that. So what is the number one thing that you need to know that you might not know about sleep? It is the renewal system of the central nervous system. It is the renewal system of the central nervous system. It's almost like the brain sends out all of its macrophages, which are the cleanup crew. It's like it sends out all of the janitors, it sends out all of the cleanup crew in the brain, and it clips off things that aren't important. It clips off connections that are important. It restores connections that are important. It cleans out any free radical activity. It cleans out any oxidative stress that's in the brain. So if you aren't sleeping, you cannot clean your brain. It's a big deal. Go back to the Alzheimer's month. This is a big deal. When you can't clean out your brain, if you aren't sleeping, you can't clean out your brain. And if you can't clean out your brain, you are creating glial priming. Glial priming is what happens when we have the janitor cells. They get real protective because there's damage, and then they Hulk smash all through the brain. And sometimes they actually kill really good cells in the process if we don't shut it off. And sleep is how we get those cells to do better. Sleep is how we get them to proactively keep the brain healthy. And I hope at this point you understand the brain is my focus. The brain and the gut. I love your guts. I love your brain. And so I want you to do whatever you can to keep those healthy. So when you sleep, you're actually creating safety for the brain. You are decreasing inflammation of the brain through reducing glial priming. You are getting rid of free radicals. Those are the damage-creating things in your body. You are actually creating proper connections. Have you ever tried to learn a task, not really gotten it that day, gotten frustrated, gone to sleep, and been able to wake up and go do it the next morning? That's what happens during sleep. It's the clipping and connecting process of learning new skills. It's what happens when you're going through a growth spurt when you're an infant. It's how and when memories are made. It's that clipping process again. It's getting rid of what doesn't matter, and it's connecting what really does matter. And it only happens during sleep. So if you stopped sleeping really well when you were 20 because you were in college and you were staying up all late, let me just tell you, there are studies now. If you are hanging your hat on, I'd pull in an all-nighter all the time, and I just barely sleep. I got like 3 hours of sleep last night. You are killing your brain, because they actually are seeing that particularly in women, the sleep that you got between your 20s and 30s, so that 2-decade period, that's 20-year period of your 20s and your 30s, the sleep that you got in your 20s and your 30s is highly predictive of your brain health in your 60s and 70s. Let me tell you, I read that, saw that, and then read it again. I was a little bit scared because I ain't sleep through the night for 9 years with my children. So I want you to do everything that you can to get proper sleep, to protect the brain, get rid of the inflammation, get rid of the free radicals, make those proper connections, get rid of connections that don't matter, and be able to properly input all of that daily stuff. So we integrate the daily activities. We integrate new movements. So like I said, maybe you went skiing for the first time and you totally sucked at skiing the first day, but you did it and you did it and you did it and you did it, and then you were awful and you were sore, but you woke up and you tried it again the next day, and all of a sudden you're a gigantically great skier. It's because that's how the brain works at night. It clips off extraneous and it puts together the important. So sleep is hugely important for brain health. And when your brain is healthy and your digestive system is healthy, the rest of you will be healthier just because of those two things. So what do you need to know about sleep? Sleep on your back with a firm mattress, low pillow, no pillow. You need to sleep for hormone balance. If you can't lose weight right now and you aren't sleeping, if you aren't getting adequate sleep, then that's probably why, because the hormone balance is off, because you're not allowing your body to rest and renew itself. If you are a mouth breather, you're probably suffering from anxiety, depression, inattention, ADD, fatigue, decreased energy just overall. And it's more than just sleep apnea. It's more than that. It is a disconnection between the brain and the respiratory system. This is a big deal because this is an automatic system, and when your brain disconnects from the automatic, there will be big problems down the road, because it's all about the brain. We cannot just say, oh, we're going to look at this one box of something that's wrong. It is a global problem. So you want to make sure that we train that mouth breathing. We do that, again, weighted chest, breathe in through the nose and close the mouth. Or you can practice the box breathing while you are not laying down on your back. And that's 4, in for 4, hold for 4, out for 4, hold for 4. So it's in that box breathing that we really begin to create awareness of the breath. And we remind the brain, this is how we breathe. Okay, so that's how we want to really work with that. Sleeping is imperative for brain health. And when your brain gets sick, it's a big deal. So it is the renewal cycle of the central nervous system. It is how the brain cleans itself. It's how the spine cleans itself. I've heard it described as it's almost like the dishwasher cycle goes through the central nervous system, cleans it all up, gets it all nice and shiny and ready for the next day, for the next use. So it's really important that you get enough sleep. If you aren't getting enough sleep, melatonin is a great place to start. If you can't stay asleep, that's an adrenal cycle, especially if it's between 2 and 4. I've been doing this for a long time. I'd love to be able to help you if you are having trouble sleeping, or if you just don't know which melatonin to try. You just don't know why you can't sleep or why you can't stay asleep, and you really know that you need to sleep and you just can't seem to do it. Or if you're in pain when you sleep, I'd love to be able to help, because sleep is absolutely imperative for great health. Thanks for hanging out with me on Deep Dive. I am Dr. Kimberly Minnick. Any questions, leave them in the comments or send me a personal message. If you want to know what my favorite things are, go to my notes page and you can see all of my favorite things from there. I have them listed out for you. You guys have a great day.